The state of Michigan has a new plan to help families and people living with autism. We told you about the program's goals earlier in the hour. We want to take it further now, and joining us for a little perspective on this is Dr. Mohan Krishnan, Director of Children's Services and Clinical Neuropsychology at Hope Network Center for Autism. Doctor, thank you so much for coming in.
Thanks for having me.
Reaction initially to the proposal as it stands tonight. What's your feelings about this plan?
Well, there's been a lot of work going on behind the scenes in the past year putting this together, and so a lot of it wasn't a surprise to us, but basically my response is it's an ambitious plan. It coordinates a lot of pieces to put together an end-to-end solution, all the way from early diagnosis for little kids to serving adults with autism. I think if we can put this together and do this, we'll really lead the nation.
I know folks, families struggling with autism have long wanted something, some oversight, something on the state level that would help them get help. Do you think that this meets the needs that the families have out there right now?
I do. I think this is going to be a process. There's a lot of infrastructure the state will need to build, and the plan outlines a lot of that. But as we put together the pieces from education to healthcare to state vocational initiatives, I think that'll start to come together.
Do you think that you'll have enough input, I guess, physicians and those on the front lines fighting autism, will they have enough input in the oversight of this kind of plan and not leave it up to the bureaucrats in Lansing?
Well, one of the great things is a lot of us have already been involved in this process over the last year. Dr. Colleen Allen, who runs the Autism Alliance, is actually a speech pathologist who practiced her entire career at Henry Ford up until taking on this role. And so I think that our views and the views of parents and even people with autism themselves are being taken seriously.
A lot of people that we talk to today say, yeah, this is a good start, a good place to start. What still needs to be done?
So that infrastructure, we need to build more clinical capacity to evaluate and treat children. We need to build more school services for the large number of children we now have with autism spectrum services in school. We need to build college and technical vocational training. We need to build solutions for independent living for these people.
Building solutions both for kids right at the onset of this and for people that may be struggling with it right now as adults.
That's right. Autism is a lifelong condition, and there's a lot that still needs to be done in terms of serving adults.
Dr. Mohan Krishnan with the Director of Children's Services and Clinical Neuropsychology at Hope Network. Doctor, thanks for coming in tonight.
Thank you very much.